So in this video, we are going to be talking about the blood vessels that you'll need to know for Psi 1070L. Go ahead and start to zoom in. We're going to begin with the arteries. So as we add in the cardiac system, right, with the heart and all of the vessels, we're going to start centrally and then work our way out, naming all of the arteries as we go. Remember that arteries and veins are named either arteries or veins based off of the direction of their flow. Arteries leave the heart and veins come back to the heart and drain blood from the periphery back centrally to the heart and ultimately to the lungs to get oxygenated. As we zoom in, you can see from the heart you have the ascending aorta here, the aortic arch, and then as we rotate, you can appreciate from the medial view that large red vessel coming down is the aorta. We have our descending aorta, the aortic arch, which turns into the descending aorta, and then the thoracic and abdominal aortas. From the aortic arch, there's three vessels that you'll need to know. The first one being the brachiocephalic artery, which then on the right-hand side branches into the common carotid artery and the subclavian artery, which is this one. On the left-hand side, the patient's left-hand side, there is no brachiocephalic artery. Directly coming off of the aortic arch here, you have the common carotid and the subclavian artery. On both sides now, but we'll focus on the patient's left, the subclavian artery then turns into the axillary artery. Apologize. There it is. The axillary artery. As we make our way further distal, the axillary artery then becomes the brachial artery. And then as we come even more distal, just past the elbow here, that radial artery where you can see the distal portion is still highlighted at the top of the screen, will then branch to the ulnar artery on the medial side. Notice that that is the ulna there. The ulnar artery is named after its location. And then on the lateral side, where we have the radius, we have the radial artery there. And then I'll zoom out so you can appreciate that those vessels will make their way all the way distal to the wrist. Now, we'll talk a little bit more about the lower extremities. It's important to remember that the aorta descends all the way down into the abdomen. Now, it does look like quite a bit of mess in here, but I'll make it a little bit easier for you to appreciate. There are two vessels you need to know that branch off of the aorta. Notice, so here we have L2, so lumbar vertebrae 2. We've got lumbar vertebrae 1 just above that. Just anterior to those, to L1, we have the renal artery on the right side, and then we have the renal artery on the left side. Those you'll need to know. As we come down distal back to the aorta will branch into two different vessels, so the right and left common iliac arteries. Common iliac artery will then branch into the internal and external iliac arteries. So here, it's important to appreciate for the clinic that here the external iliac artery kind of runs more anterior and superficial, whereas the internal iliac artery dives deep to then feed the organs of the pelvis. So it isn't just like on the blood vessel board, you'll see it kind of looks like it runs medial and lateral. That is not how it is in real life. In real life, the internal iliac artery goes deep. The external iliac artery, where you see it's highlighted, will then turn into the femoral artery. Ignore that it says deep femoral artery here. You just need to know that it is the femoral artery. Okay, and that's it for arteries. We'll go ahead and switch our way over to veins. We will begin still in the lower extremity. We'll work our way back up to the heart, and then we'll see what's going on in the upper extremity. So we have the femoral vein here as we make our way up more into the central, external iliac vein, internal iliac vein. Those two come together to form the common iliac vein. The right and left common iliac veins will then come together to form the inferior vena cava. Then that comes back up to the heart, feeding into the right atrium. We'll now move over to the upper extremity. This is a little bit more complicated only because there's an additional vessel that you need to know beyond what is in the arterial system. So here, We have our ulnar vein that is on the medial side, just like with the arteries. And then just superficial to the radius, we have the radial veins. The radial vein and the ulnar vein will then come together to form the brachial vein. But just superficial to that junction, there is the median cubital vein, which is here. Notice that it doesn't actually have a portal into either the ulnar or the radial or the brachial veins, but it does form a junction between these two vessels, the cephalic vein and the basilic vein. Now, you don't need to know cephalic and basilic, but you do need to know the median cubital vein. You'll know what vessel is what based off of its junction zones. So the medial cubital vein, if it's running horizontal and is attached to the two vessels that you don't need to know, then you'll know that that's the median cubital vein. And it's easy because it runs horizontal. If you have one that is running vertical, it's in this area, it's either going to be the brachial veins, which are here, more superficial, running along the humerus. And if it's distal, then it'll either be the radial or the ulnar veins. So brachial vein is the one that is highlighted now. As we come closer to the central area, back towards the heart, we then have the axillary vein. The axillary vein becomes the subclavian vein. Subclavian vein then becomes the brachiocephalic vein here. The right and left brachiocephalic veins, notice that you do have a right and left brachiocephalic vein, come together to form the superior vena cava, which then feeds into the right atrium. The last bit that you'll need to know is that the internal jugular vein is here, and just for context, we'll highlight the external jugular vein, which is here. Notice that those vessels feed from the scalp and is a much smaller vessel, and I'm sure you can appreciate that there's less blood coming back to the heart from there compared to the internal jugular vein, which you can see enters through a foramen into the skull, which is then feeding blood from the brain. The brain has much more blood than the scalp. Given it is a more important and vulnerable vessel, the internal jugular vein. That's all that you'll need to know. Thank you for your time, and I hope this helps you study.